to consider before we determine what changes to make on the ventilator. So the next question to ask yourself when your ventilator is alarming is, what do I do? And you're going to hear us say this over and over as the lecture goes on. Always check your patient first. The first thing you want to do is take a look at your patient and see if there's an easy, simple fix that you can do to stop the alarm from ventilating and help your patient breathe more comfortably. So with the first alarm that we were talking about, the increased tidal volume, minute ventilation, or respiratory rate, is the patient's demand for minute ventilation increased? Because of the cause of that, does he need more breaths? Is he taking deep enough breaths? Does he need all of that? If so, then you need to increase your VE demand and determine if that change is needed and go ahead and do it. Is the ventilator auto-triggering? Check the sensitivity. If your sensitivity is too low on the patient and every time they even move around, the vent thinks it wants a breath and it's giving the patient a breath all the time, then the alarms are going to be going off that the respiratory rate is too high on the patient. To fix that, you would just increase the sensitivity, hopefully decreasing that alarm. Is a nebulizer in use? If we're giving a jet nebulizer in line for a patient, it's increasing the flow. It actually adds an extra 8 liters of flow to the patient. So the ventilator thinks the patient's getting a much increased tidal volume. In these particular cases, you can collaborate with your respiratory therapist to adjust the treatment settings or turn off alarms or do whatever you need to do until your nebulizer treatment is complete. If none of those are the answer, then we have to call our respiratory therapist to the rescue. Another alarm that can go off is having a low pressure, low PEEP, low tidal volume, or low minute volume alarm. Some of the things that you might have done that can do this is your patient disconnected? If the patient has an endotracheal tube or a tracheostomy tube in place, it's supposed to be inflated. Is it?